When morphine ran out in Civil War field hospitals, surgeons turned to a weed growing beside the road. It worked. It was not folk medicine, it was listed in the United States Pharmacopoeia, official medicine beside morphine and aspirin, for over 4 decades. Then, in 1944, one researcher called it a superstition, and within a generation, it was gone from mainstream medicine. Not because people had stopped using it, but because a weed could never fit the business model of modern medicine. Welcome to Forgotten Plant Remedies. The story starts in Egypt, 1550 BCE. Inside the Ebers Papyrus, one of the oldest medical documents ever found, scribes recorded a plant they called lettuce of the gods. Its milky sap drove away pain and brought sleep. Greek physician Dioscorides documented it in 77 CE. He named it Lactuca virosa. The name tells you everything. Lactuca, the Latin for milk, virosa, potent. Cut the stem and white sap bleeds out like tears. Dry it and it hardens into a brown resin. Ancient physicians called it lettuce opium because that is what it could do. It relieved pain, it calmed coughs, it brought sleep. And unlike real opium, no addiction, no chains. Romans used it for battlefield wounds and insomnia. For centuries across Europe and Asia, this was simply understood. Pain existed, this plant answered it. By 1799 it crossed into America. Doctors prescribed it. Pharmacists stocked it in tinctures and lozenges. It sat on shelves beside laudanum as one more tool against suffering. Official, trusted, cheap. Then came 1861. The Civil War. Union forces issued nearly 10 million opium pills to soldiers, but Confederate supply lines were blockaded. By 1862, Confederate field hospitals had no morphine at all. Surgeons amputated limbs without anesthesia. Soldiers died screaming. Desperate doctors turned to what grew free along every roadside in the South. They cut wild lettuce stems, collected the sap, dried it into resin. It worked. Not as powerful as morphine, but it dulled the unbearable. It allowed surgeries. It gave dying men enough peace to close their eyes. One Confederate surgeon wrote that wild lettuce kept more soldiers alive than any other substitute remedy they found. After the war, something else became impossible to ignore. Opium was destroying veterans. The hypodermic needle had created an epidemic. By 1895, 1 in every 200 Americans was addicted to opiates. Wild lettuce showed none of that. Polish physicians ran systematic studies in the 1870s, testing wild lettuce and opium side by side on patients suffering chronic pain, coughs, and insomnia. The results were published in medical journals. One physician wrote that in some cases, lactucarium produced better results than opium, with none of the side effects. No addiction, no respiratory failure, no euphoria that enslaved patients to the needle. These were not herbalists. These were trained physicians, comparing 2 medicines in controlled conditions and concluding that the wild plant was safer. By 1898, the United States Pharmacopoeia listed it officially, alongside morphine and aspirin. By 1911, the British Pharmaceutical Codex added it. This was not folk medicine. This was standardized, tested, officially prescribed medicine. Then the industry shifted beneath it. Pharmaceutical companies discovered something more valuable than medicine. A synthetic molecule could be patented. A natural plant could not. Every pill sold meant decades of protected revenue. Wild lettuce grew free in every ditch in America. There was no business model in that. To stay in the pharmacopoeia, wild lettuce needed expensive clinical trials. No company would fund research on something they could never own. The plant had no protector. In 1944, researcher Fulton published his verdict. Modern medicine considered wild lettuce's sleep-producing qualities a superstition. Its therapeutic action, doubtful or nil. 2,500 years of documented use. Civil War field reports, Polish medical journals. Dismissed in one paper. What made it possible was not new evidence, it was a new system. The system where a single researcher's verdict, published at the right moment, in the right climate, could close the door on a remedy that had no industry behind it to push back. Later research revealed why the commercial products failed. The active compounds, lactucin and lactucopicrine, are unstable. They degrade in old preparations. Fresh lactucarium worked. Shelf-stable commercial products did not. But the damage was done. Wild lettuce fell from the pharmacopoeia. The last generation of pharmacists who stocked it retired. The doctors trained after 1950 never learned it existed. In 2005, scientists at the University of Arizona tested the active compounds on mice. At 30 milligrams per kilogram, they produced pain relief comparable to ibuprofen. A 2021 study confirmed the mechanism. Lactucin acts as an adenosine receptor agonist. It calms nerve signals without touching opioid receptors. No addiction pathway, no respiratory depression. The compounds also inhibit the same enzyme targeted by some Alzheimer's medications. Wild lettuce does not just dull pain, it may protect cognitive function. 75 million Americans live with chronic pain right now, 20% of adults worldwide. The pain market is worth $80 billion today and climbing. Opioids prescribed to treat that pain kill 100,000 Americans every year. And a forgotten plant remedy for pain, one that never followed the opioid path, still grows beside the road. It still grows. Right now, along roadsides from California to Massachusetts, along riverbanks across Europe, in waste ground across France, Germany, Austria, Scotland. 6 feet tall, stem sometimes spotted purple, jagged leaves with spines down the centre vein, small yellow flowers. Cut it, and white sap bleeds out slowly, like the plant is bleeding something it has been holding for a long time. The harvest method is simple. Cut stems in late summer when the sap runs thick. Collect the latex directly, dry it into resin, or preserve it in a tincture. Fresh extraction matters. The compounds degrade in old commercial products. That is why the 1944 study condemned it. That is why shelf-stable products failed. The knowledge of how to do it right was buried with the last generation who knew. The pharmaceutical industry did not set out to erase wild lettuce. They built a system where it simply could not survive. No patent, no funding, no protection. The plant had nothing to offer the machine, and so the machine moved on without it. 75 million people in chronic pain, 100,000 dead from opioids every year, and one forgotten answer has been growing in the ditch the whole time. That is not a footnote, that is an indictment. Subscribe to Forgotten Plant Remedies. Every like and every share keeps this knowledge alive. The next vault opens soon.